Now recognize the ranking member, Dr. Ruiz from California, for 5 minutes of questions.
Dr. Welensky, when you took the helm at CDC, our nation was in the darkest days of the pandemic. More than 3,000 people were dying of COVID-19 each day, and the federal government was stumbling in the race to get as many shots in arms as the coronavirus surged through our communities. Our nation's healthcare and public health workforces had endured months of unparalleled strain, and America's faith in our public health institution was battered by the previous administration's reckless mishandling and politicization of the pandemic's response. And these narratives that somehow it was American-funded bioweapon made from China and purposely released from a lab in order to harm the world. But you hit the ground running. You brought fresh energy and a renewed commitment to the CDC's mission of leading with science to protect our nation's health. As a result of your leadership, speak for themselves, those results. Within weeks of you stepping into your new role, the CDC issued comprehensive guidance that meticulously laid out the steps schools and communities could take to safely and swiftly return kids to the classrooms. Just 1 year into your tenure, the number of students who returned to full-time in-person learning more than doubled, with 95% of kids back in classrooms by January 2022. What role does CDC's guidance play in paving the way for the safe resumption of in-person learning across the United States?
Oh, thank you, Dr. Ruiz. It was instrumental. I mean, so much of what we did in getting this guidance out, and let me just emphasize, the most important thing, you can see by the fact that we released it 23 days after I started, was getting our children back to school. I had 3 of my own kids at home with me. I wanted our children back at school safely. The whole point was to get the schools open and to have them safely remain reopened. And we did that through a layered mitigation. Remember, at the time, vaccines were not available for children, and there were, we were rolling out vaccines across the country, and it was essential, this layered mitigation. What was also essential was getting feedback from our partners. We did a lot of engagement, a lot of listening, a lot of understanding.
It's a lot of the recommendations that policymakers either fail or succeed in the field due to implementation problems. So it's only prudent for the implementers to be consulted with to ensure that any recommendation will be followed and will actually work. During your tenure as CDC Director, you also worked closely with your colleagues at various levels of government to execute the most sweeping vaccination campaign in America's history. Over the more than 2 years that you spent at CDC, the federal government facilitated getting more than 600 million COVID-19 shots in arms. This historic campaign protected tens of millions of Americans from the threat of severe COVID-19 and death. During your tenure, how did CDC work with government and community partners to right the ship on the COVID-19 vaccine rollout and turn the tide on the pandemic? And what were the biggest top 2 lessons learned?
Well, first, we didn't have an infrastructure to support vaccine rollout, and we still don't have an active infrastructure. That is something I would really request from Congress, is that we have a Vaccines for Adults program so that we can roll out vaccines again in the future. But we worked across all of government, private sector, private partners. We had a federal retail pharmacy program that was able to reach people where they were. We worked on equity initiatives. The biggest divide was across rural and urban divides, that we were not reaching as well urban people, so we had to do that. We worked with community-based organizations, faith-based organizations. This was an all hands-on-deck approach.
Thank you. Dr. Welensky, your departure from the CDC comes at a time of transition for our nation. Under the Biden administration's leadership, we've emerged from the darkest days of the pandemic and are now tasked with the critical mission of preventing and preparing for future threats to our public health. This is not the time to let up on the gas pedal. Instead, it's our time to recommit to the mission of empowering and investing in America's public health institutions, which work on the front lines of emerging threats to keep us safe. As we look to the future, what are the 2 actions Congress should take to have the greatest impact in ensuring that the CDC is equipped to get ahead of the next potential pandemic?
The two biggest ones would be, in my mind, a focus on data, our data highways, whether our data systems are coming in. We do need resources for our data highways and to have data authorities so that we can see the data that are coming and we can act nimbly in real time. That would be one. The second, in my mind, would be expanded workforce authorities so that if we're expected to be a response-based agency, we have the authorities of other response-based agencies, direct hire authorities, overtime authority, danger pay, those sorts of things.
You know, I think these are the critical things that we should work towards building, and let the theories and the accusations without evidence that are oftentimes made out of context go, so that we can actually work on the important priority things that will save lives. With that, I want to thank you, Director Welensky, for the tireless dedication you've shown to America's public health during your tenure and for your time today.
Thank you so much.
I yield back.